Hi everyone, it's a pleasure to be here. So yes, I'm presenting this with my colleague, Professor Karen Spilsbury from the University of Leeds, and it's on behalf of a huge team of amazing researchers and sector leads who I'm going to be introducing as we go. So I'm going to start by giving you an overview of the partnership, just so that you've got some context about where we're coming from. So the Care Work Partnership, or the Social Care Workforce Partnership, which is the long title, is one of 5 health and social care workforce partnerships that have received considerable investment from the NIHR Health and Social Care Delivery Programme. We have 5 partnerships funded over 5 years, all started in March last year, so we're coming up to 12 months into the programme of work. And ours is the only one that is social care focused. The others focus on different parts of the health workforce, and one is specifically focusing on workforce wellbeing and cutting across, and will be working very closely with our partnership. What they all have in common is that overall aim. So they want to evaluate innovations, and this is grassroots, bottom-up innovations that are already happening in the sector largely, and ultimately look at ways to support the sector in terms of improving retention, recruitment, and preventing stress and burnout. So huge remits, but 5 years worth of work. So I mentioned that we're a big programme. We're huge. It's co-led by Karen and I, who will be joining me for the Q&A afterwards. And we have 33 people working across 13 organisations, so a really large team. And I hope that you will be pleased to see that it isn't just academics. We have 5 universities involved, but actually out of those 13 organisations, the remaining are all sector partners. So we have 3 national provider representative or bodies, organisations, Skills for Care, National Care Forum and the Home Care Association. And we also have 4 local authorities and their attached ICBs and the Leeds Health and Care Academy. Behind that is an enormous number of individuals. So if you would like to see who's involved, please take a look at our team page. So thinking just of care work now, the Social Care Workforce Partnership, let's be a bit more specific about what our aims are. So as well as wanting to conduct research that will make a step change for the sector and with the sector, we actually have some slightly wider goals as well. We want to make a difference around implementation and learning. So we see this partnership not just about creating some of that knowledge, but also about mobilising some of that knowledge back into the sector. So we have a knowledge mobilisation expert on our team, and we're working with our sector partners to build an evidence repository and create lots of hopefully creative ways of disseminating to the sector, picking up on some of the things that have been spoken about this morning about it's no good just to churn out the research. You've also got to think about how you communicate that research to the right people to make a difference. Building workforce capacity, this is NIHR at 20. Social care still needs a lot of investment in terms of workforce research capacity building. There's been enormous strides made in this, particularly from the School for Social Care Research and the applied research collaborations over the last few years. But we see this as also an important goal of our partnership. So we will be building in roles for practitioner researchers and making sure that we're supporting practitioners who are undertaking career development awards, for example, and fellowships, and looking at ways to connect with those people and bring them into the partnership so that they benefit from our wider goals and our networks. Part of this is developing a community of practice, and I'll say a bit more about that in a moment, but also recognising that from all the work that we're doing, we're coming up with more ideas for research than we can possibly do ourselves, even with a big programme of research. So we'll be looking for other partners as the work progresses and to leverage further funding so that we can try and take as much of this work forwards as possible. So we have 4 themes. You can read those there, and some fantastic people leading those themes across the different universities. And what we've been doing at the moment for the first year is thinking about, well, really it picks up on what was said this morning. The first phase of this work has really been about listening. So we've done a huge number of consultations, which I'll talk about in more detail in a moment, but we're very much situated in that consult and co-design stage of the work. As part of the partnership setup, we've also been doing some of the stuff along the bottom. So setting up our management, our government updates, our steering committees, but also building community involvement and engagement groups, so recruiting to those groups. And that work is led by our team, Leeds Beckett, with some input from King's and also the National Care Forum. And we've got 2 fantastic community involvement engagement groups, one which is frontline workers, so people still now working in frontline roles, diverse roles and from different parts of the country, and also a lived experience group. So we have 2 of those groups that are feeding into every aspect of the work that we do. So we're also conducting some sort of what we're calling phase 1 projects. We've got 2 of those, and they are, broadly speaking, on the topic of recruitment and retention in adult social care. So they're linked, and you'll see how. So the first one is led by Karen and the team, and it's called the Oscar Study, and it's all about attracting and recruiting and retaining younger workers to the social care workforce. I'm sure lots of people in the room are already aware, but the mean age of social care workforce is around 44 years old, but around over 25% of the workforce are over the age of 55. What we know is that we have an ageing workforce, basically. And we also know that the under 30s have the highest turnover, so that they're more likely to leave the sector. So this study is trying to address that evidence gap and work out what we can do as a sector to attract and, most importantly, once we've got them through the door, retain that younger workforce. We're doing this by working with Skills for Care, and we can take some questions on this at the end if people are interested in getting into the detail. But using the Skills for Care data, we've been asking them to seek out positive deviants. So people, organisations that are working within the adult social care sector that seem to be doing this particularly well, and then treating them as case studies and speaking to them about what it is and unpicking what it is that they're doing that is particularly working, so that we can start to draw out lessons and hopefully in the future test those with other organisations to see if we can share that learning to the benefit of all. So to find out more about this, and you'll see tons of QR codes on my slides, because really we're at the early stages, so it's all about engagement. If you want to find out more, please scan the QR code, and also Karen and I are here today and can take questions on this study. So the second study that we've been doing in the first 12 months, and these are all ongoing projects, which is why I'm not sharing lots of results. This is the Leaver study. So this is at the other end of that spectrum of recruitment and retention. And this is a responsive study. It was funded by the NIHR Workforce Partnership, but co-funded by the DHSC via the Policy Research Unit for the Health and Social Care Workforce. So this is where we've come together with 2 funding streams to collaborate to be able to deliver a very quick turnaround on a responsive project. The opportunity for this project arose because we've been involved in the National Workforce Surveys, where we have been doing some longitudinal survey work, asking people both in 2023 and in 2025 who work in the sector to talk about their workforce wellbeing and their quality of life. And we realised this presented a fantastic opportunity in that 2-year gap, people that were reapproached for the survey last year, some of them told us they're no longer eligible, not because they've changed roles within the sector, but because they've exited the sector altogether. And what we wanted, and what DHSC is particularly interested in, was finding out why and what would have encouraged those people to stay. So these are very much emerging findings. We're only, actually it says 18, but since writing these slides, we're now 20 interviews in. And we're obviously reflecting on the data as it comes in, but it's yet to be properly analysed. But what I think is really interesting is that about half the sample so far who have left the sector haven't left to go into other jobs, but are now economically inactive. And this is directly related to their experiences in their roles. So we're going to be doing some work to unpick some of this. And this is across roles, so social workers, care workers, managers, not just one part of the sector. Some really interesting stuff here around the decisions to leave. Obviously some stuff here around burnout, which is going to be really important, and sick leave. But I've put at the bottom, people don't leave job, they leave managers. And this is a recurring theme. All 20 interviews, this has come up. so far, which is that actually maybe if they'd had support, they've been supported differently, they may, and earlier, so sooner, they may have stayed. So really excited to be able to finish this data collection and do some proper analysis on this. So you're getting emerging findings, so treat with caution, but some really consistent findings so far. So the other really important stage of the work that we're in now is around planning the second stage. So when I showed that timeline, we're in the first 18 months, we have an 18-month review point, and at that point NIHR will approve all of the work that we're planning to take forward for our final 3 years. So we've been doing a lot of consultation and listening to make sure that we get this right. So the objectives of this consultation process were essentially to identify what innovations are already happening in the sector. So not to reinvent the wheel, not for us to come along and say, we want to try this out and impose our ideas, I guess, on the sector, but rather to say, tell us what you're doing to address some of these things. Tell us about things that you think are working so that we can evaluate them and learn from those and then share that learning with others in the sector. We're also working with our community involvement engagement groups and the wide partner network that we've got as part of the partnership to then prioritise those ideas, and that will go into a co-design phase where we take forward the work for the future programme. So tell you a bit about what we've done so far on those consultations. We're coming to the end of the consultation phase now. Consulted over 100 people, and these are all people who've got ideas or are doing interesting or innovative things, so specifically those groups. Over 40 different innovations were brought to us over those 100 consultations. So there's a lot going on, all focused on the workforce, just a reminder. So they're not about the ways of working, but the ways of supporting the workforce. 27 potential new solutions, so things that are not already happening, but ideas that people have got. So you've got 40 things that are already happening and 27 that are about, well, it's not happening, but we think this could work. So this might sort of seed ideas for future projects. And what we've been doing behind the scenes alongside these consultations is trying to assess each of those ideas. So looking for, okay, they're using it in this area, or this particular organisation is using it. What's the evidence for it? Is there similar things happening? Have similar things been evaluated already? What can we learn? Is there an evidence gap? Is it novel? Is there potential for this to be replicable and make a difference to others? So it's happening here, but what potential do we think there is to take this work forwards, and will it be useful for others? So we're doing this by checking the research evidence, taking advice from our sector partners and our community involvement and engagement groups. And I'll move on to the next slide. And we're now moving into the next steps. So we're concluding our consultations this month, so it's still very much live. And then we will be going on to produce some project outlines. So we've been slowly whittling this down, these ideas down over the last year. What I would like to do is encourage all of you, if you're interested, in signing up to our community of practice. So we already have over 160 members. That includes people working in the sector, commissioners, local authorities, provider organisations, frontline care workers, personal assistants. We have people who are drawing on care and support and their families as part of the community of practice. And we have researchers. So if you're a researcher working in this field and you're interested in connecting to this wider network, please do join our community of practice. And this will be our mechanism for doing that last final bit of wide engagement. So having got these ideas and innovations, whittled down some potential project ideas by those themes, we'll be taking them to a community of practice in May in a webinar style, where we'll be presenting potential project ideas for our future programme of work and getting that community of practice feedback. And that will determine the work that we present to NIHR at the end of August. So if you would like to get involved in that, please do scan the QR code. So that's all I've got to say about our partnership. I'd like to invite Karen up onto the stage with me to answer questions. And yes, happy to take any questions either on the projects that I mentioned or on the partnerships work or how you could get engaged with the work going forward. Karen.
Hello, hi. Thank you so much for a fascinating presentation. I am Julia. I'm doing a PhD at UCL on the workforce recruitment, well-being, and health. So it's very aligned with what you're doing. I was very interested in what you said, that a lot of people that left the workforce are now inactive and not actually joined another sector. And maybe you could tell us more why. Is that for maybe they contract an occupational injury or maybe burnout or so on? Thank you so much.
Yep. So with the proviso that this is emerging and the sample is so far only 20, but about half of the sample of 20 so far are in that position where they're economically inactive, and they've got their individual reasons. But what's really interesting from our point of view is that regardless of whether there were some physical, maybe health issues going on, some of it was to do with aging. So the topic of, I talked about the fact that our workforce is aging. It's also predominantly a female workforce. So in a couple of cases, we've had stories of, I was going through the menopause and I didn't feel supported. So some really interesting examples of that, alongside concerns around personal safety sometimes. So lone working with populations of social care users where sometimes that behaviour can be challenging or difficult for people, and then maybe feeling unsupported. So it's not about the behaviours themselves that people were encountering, but the feeling that they didn't have the support around them, or sometimes not the training that they required to feel equipped to deal with that. And my sense, and my colleague Wenjin can't be here today, but she's been doing many of these interviews, is that actually if there'd been the right kind of support earlier on, actually some of this could have been headed off. And so I think thinking about where we take this in the future, it will be thinking about what steps could have maybe been put in place sooner. And I think it's reminded us of that slight lottery. And during the consultations, sorry, I'm jumping around, but during the consultations, what's come up a lot has been the importance of good management and leadership. And actually, it's a bit of a lottery, it feels, as to whether you can work for one organisation but be in a team with a really supportive, fantastic team leader or manager and have an entirely different experience that someone who's working in the same employer, the same organisation, but has a different team and a different manager and a different approach. And so I think if we could find a way to tackle some of that, we might make a real difference to people's experience and whether they leave the sector because they feel they've got no choice because they've burnt out.
Thank you.
Yeah.
Great. So we have a couple of questions online. So the first is from Joe Blackwell, who says that they're interested in the choice to use consultation, and if ideas generated via this means and the people sharing them were taken into more of a co-design or co-production process, and why co-design wasn't undertaken from the outset. So
no co-design yet because we don't have those projects. So the projects that we have talked about today were co-designed as part of one was co-designed as part of the application process, and the other one was a responsive project. So it was co-designed with our CIE groups that we'd already established and our sector partners. So those were co-designed. No co-design yet because the consultation is going to feed into, if you like, identifying the innovations and setting the priorities for the work that we go forward, and then we move into co-design stage. So it's a staged process. Yeah.
Thank you.
Hi, my name is Amal. I work as Freedom to Speak Up Guardian here at Guys and St. Thomas. So we deal with people who come to us with concerns regarding their work that they don't feel comfortable raising.
Yeah.
And I really wanted to ask about the really interesting leaving interviews that you mentioned. And we also noticed that leaving interviews tend to be a very good way to find out why people are not satisfied with their job. But you also mentioned how with the right support and with the right management, they might have stayed in the job. So I wonder, has there been any sort of, and is there ways to do data collection of people who are still in their jobs, who probably are struggling, but don't feel comfortable sort of sharing it? And I also want to specifically raise this because in social care, we do have a lot of international staff, and I imagine a lot of them are tied up in visas, so they might not feel comfortable leaving or able to leave. So is there a way to get data on them as well that's involved in this sort of research? Thank you.
That's a really great question. So we're at the mercy for this particular sample, because of the way we've recruited them, we're at the mercy of people who had completed the surveys, then said they'd left the sector, then consented to pass details to us, and then agreed to take part in an interview. So, you know, I think we will need, if you like, ad hoc to look at the representativeness of that sample and the diversity that we've got within it, and then plan future work to address some of that. Because this is a very specific, responsive, quick turnaround project, and we're at the mercy of all of those things. Having said that, what we hope to do, and it will be possibly proposed as a project as part of our future work, is that I mentioned this sample are drawn from that sort of national survey work. What's been really interesting about the qualitative work is that it's helping us understand better the kind of variables that we might want to explore quantitatively using that bigger data set, which is more diverse and representative because it's naturally representative and it's been weighted to represent the different parts of the workforce. So what we hope to be able to do is use this so that we can tailor or design a project that might be able to address some of those questions at a more nationally representative level. Yeah. Okay.
We have a question online from Julie Watson saying, this is great work, thank you. When you talk about the adult social care workforce, which settings and contexts are you including in that?
Yes. So do you want to answer it for the leavers, for the Oscar study?
Yeah.
So it'll vary by the studies that we're doing. So if thinking about the Oscar study, that's very much trying to understand what adult social care organisations that submit data to Skills for Care are doing to attract, recruit and retain a younger workforce. So for that particular study, we're focused very much on the care staff and nurses working in those care organisations because the numbers are big enough to look at that. And that doesn't say that other staff employed in those organisations aren't equally important, but it's looking at what data we have to be able to identify organisations that, if you like, are excelling at this and doing really well at not only attracting, but keeping those younger workers. But I think what's really important, and we had a long conversation about this, is recognising the importance of social workers as well. We're not including them in that particular study, but what we have done is support a colleague who is a social worker working at Leeds City Council, Atlanta Bradshaw, who's got an NIHR School for Social Care Research Career Development Award. And as a social worker, she's going to focus on that area. So I hope what you get a sense of is that sometimes the questions, the methods, the way we approach it means we might have to have a targeted sample, but we're critical of, well, then what might be missing and how might we also address that to start building up the evidence base. So I think the short answer is it really depends on the studies, what contexts and which workers are involved. And I feel like we have enough people in the team who keep us on our toes and ask us questions all along the way of, but you might be missing this group. What are you going to do about that? So hopefully we're starting to build momentum and a real portfolio of work that can start to make a difference. Would you add anything? No. Okay. I love the way you've moved me to the microphone.
Hi, Sandra Prue. I've got two questions, if I can be really cheeky. The first one is, you talked about people leave the job because of managers. It's great people who do great work that get promoted to be a manager, but are you looking at training for managers? Because it's much harder to manage people than to manage the work. Yeah. So I'm wondering if that's something that you're going to consider as part of that, because those development skills are essential. Yes,
it's such a good question, Sandra. And honestly, training has come up, leadership training and management training, and the fact they're not the same has come up a lot. It's really interesting. it's really difficult methodologically to demonstrate the impact of leadership training down the line. So to be able to, you can run a training course, and then you can ask people their experience of the training course. Do they feel they learned anything? Do you feel it's changed your practice? They can reflect on it. They can answer all those sort of things. It's actually much harder to then demonstrate that because they went on that training course, it had a positive impact on their team and the way they led that team, particularly recruitment and retention, which takes time to be able to capture. So it's something that we're thinking about, don't necessarily have a solution to at the moment. The other thing just to note that's come up from during our consultations, because it came up a lot, we've done these waves of consultations and it's come up across the different themes. So we've brought this back to our sector partners, but also to our CIE groups, is the observation, which I think is quite an astute observation, is that actually a lot of people go on a lot of training courses for leadership and management, but we still see this variation. And so there is something else going on that's beyond just go on a training course.
Absolutely. It takes a lot to be a good manager, doesn't it?
Yeah. And maybe we talk about culture, and one of the things that I think is really interesting is these micro cultures, because it's not just enough to say this organisation has a great culture. You can have a great culture here, and in the team that works alongside them but has a different lead have a very different culture. So I think it's something that's sort of washing around in our heads, and it may be that we need to do some more work. So it may not make it into the cut for the 18-month deadline, because it may be something that we need to do a bit more thinking about before we plan that work.
Okay, thank you.
Yeah.
My other question, cheekily, was how are you promoting your studies? Because people can only take part if they find it, know about it. So just wondering what methods or channels are you using to promote it that people here could then potentially share and promote onwards?
Do you want to answer? Yeah.
So with the younger person study, we've been working with Skills for Care, who, when they've identified organisations that are excelling at this, they have invited them to contact us as researchers. They have to remain anonymous. So we've been working with those partners to help facilitate those introductions. When we get to the final stages of the study, so obviously we're hearing from organisations and their innovations or what they're doing to try and secure that younger workforce. What we recognise is that what might work in one organisation might not be suitable right across social care. It's such a landscape and varied landscape. So there will be an opportunity in the final stages of the study to come along to consultations where we'll be presenting what we've heard, what people say are working, in what kind of context, to really unpack. So where might the limits of that be? So there will be an opportunity at that point, and I will be advertising it through various networks. I'm sure we'll be in touch, Sandra, but obviously through the Care Work Partnership and our pages there as well. So yeah,
And our community of practice.
and the community of practice. Thank you.
Hi. Thank you again for such a really interesting presentation. I've got two different hats that make this really interesting. I'm a public health doctor and obviously interested. This is important for the sustainability of the workforce, but clearly it's also really important for the health as an important determinant for those working in the workforce. My question is actually with my other hat, though, which is that I'm also an officer within the trade union that I'm a member of. And I'm really interested if you've engaged with, or if you see any role for trade unions within this piece of work as sort of, you know, both an important mechanism for bringing people together, but also holding employers to account where they're falling short.
So yes, that is a really interesting question. So at the moment, union membership amongst the social care workforce is still relatively low, and they're spread across several different unions. So, but as you probably know, there is a lot going on coming up around sort of the Employment Rights Bill, Fair Pay Agreement. And so the unions are starting to get more involved in this and starting to engage in discussions and think more about how they can encourage membership from people working across social care. as part of future waves of the survey, what we would like to do, if we can receive funding for that national survey, is engage the unions as part of maybe expert reference groups within that, so that we can try and have a kind of two-way relationship. Some of the unions, I think Unison and maybe TUC, were involved in the first wave of the national surveys, and they were really engaged and really insightful. So I think there's an appetite there, but at the moment, union membership is still very low. Yeah.
We have a question online from Anyek Smets, who says, I've noticed that part-time work is quite rare in adult social care in the UK, especially in comparison to the Netherlands, where I qualified. And I'm wondering whether moving towards more working flexibly or part-time work would help with staff retention. Is this something you could look into?
Yes, that's really interesting. I don't know if there's more part-time work actually over the social. There's a lot of part-time workers in adult social care in England, but I don't know the numbers off the top of my head. But if you look at the adult social care workforce surveys, again, that national survey data, there is an association between working part-time and having better work well-being. So that's definitely something that would be interesting to explore. Yeah.
Hello. Oh, sorry. Hi. A fascinating presentation. I'm wondering if you are also considering the physical environment. I'm here at the back.
Yeah.
Oh, thank you.
So I'm a lighting consultant, and I know that lighting makes a big difference to people's ability to sleep, mood, a whole bunch of stuff. And I wondered whether sort of environmental conditions are part of your work. Thank you.
That's really interesting, and the short answer is that has not come up in any of the consultations actually. But then I guess maybe if you think about the question that we're asking, which is what are you doing to support and retain and reduce burnout? So nobody's brought an idea to us along those lines, but that's a really interesting one, and it's something that we think about a lot in terms of maybe sleep quality in care homes for the residents, but we don't tend to think about it for the workforce who are equally affected. Yes, Karen's got something to add.
Yeah, I'll add, and it's a bit outside the Care Work partnership, but certainly in some of the work we've done at Leeds, environment has come up when we've been working with care homes. And so that might be about the physical environment and how it supports someone who's living in the home in terms of their quality of life. But actually, it's also about the quality of work for staff in there, and that, working in there. And that relationship between the two is absolutely key. How you feel at work is going to influence the quality of your interactions. And also, just to mention, so Daniel Hind, who's a research fellow in our team at Leeds, he's doing some work around extreme heat. And that's really, really important as well, not only in terms of physical health for the residents, but physical health for staff, and how, that has an impact. So, as we get more heat waves, a really important topic. So if you're interested in that, then Dan is probably somebody to make contact with.